Warning, the following is entirely satirical and should not be taken as truth or fact. Styles Rebel Radio and the Rebel Podcast do not own any copyrighted material that may be included in this broadcast. Viewer discretion is advised.
It's all just a tub of white or blue or green, whatever, liquid, like...
Suspend the show right now!
You're gonna zipline directly into the harpoon?
Yeah,
What do you know about planes?
I know a lot about planes.
Buckle in, dude, it's gonna suck.
Put your hand on the screen.
How did they find out? Who was the one?
This show has gotten infinitely more gay.
The mystical land of New Jersey.
I don't understand how the laws in this country work anymore. Welcome to the Rebel Radio Show, live, uncut, and uncensored on WSRR Radio. We're saving the underground music scene. To my right, Shaney.
Hey, everyone.
On the board is Jules.
Howdy.
I'm Radio's Rebel DJ style. It is conspiracy season here on WSRR. Took 3 weeks, but I got the timing down of when you're going to do that now.
Yeah, it's right about then.
Well,
There's another one.
we're brought to you by Synergy Music Studio out of Chicago, genericlothes.com, and Hellbender Vinyl. They're Pittsburgh's first and only custom vinyl record pressing plant here to make your next album release more than a bunch of just ones and zeros floating around online. We've covered a few things this conspiracy season already.
Yeah.
Covered the Zodiac Killer, time travel.
I'm him. I'm both of those things.
Let me tell you a
I'm
little
a
something.
Zodiac killing,
hey.
time traveling,
Let me tell you.
big farming.
I got Big Farmin'.
Yeah.
I got to tell you a little something.
Go ahead.
You're not him. What did we talk about last week?
What did we talk about?
Martin Luther King.
That's right. Deep
And-
state cover-ups.
And
Ong's hat.
Ong's hat.
Good old Ong and his
Ong's
hat. I love wearing it. I'm still wearing Ong's hat.
I'm still wearing my brand new WSRR October merch where you can get with the Zodiac cipher on it. Go to WSRRradio.com, click on the merch and support button. Hey, while you're there, you can also help donate to the station by going to the Venmo. That's at WSRR Radio. Helps keep us and all the great local musicians on air along with our awesome sponsors. Today, we're going to talk about Big Pharma.
Bump, bump, bump.
And
You
I-
have to buy prescription drugs.
Yeah, I realized, we set up we talk about this every week. We set up the litany, the lexicon, the rundown for the month of
Yeah.
these theories.
Yeah.
And Big Pharma was one that I really wanted to do because there's very few things that are serious issues that we talk about on the show that I am genuinely passionate about. And, every so often we talk about like men's mental health and we talk about the fact that we don't really know the dangers of cell phones and radiation and 5G and things like that. We've talked about the childhood obesity epidemic at one point. And Big Pharma is one of those topics. And I didn't know where to even start with this. But I feel like a good starting point is the name Pharma.
Yeah.
Because this is where I started thinking about using this as conspiracy season material, is the name pharmaceutical, pharmacy, all derives from the root word pharma, which derives from pharmakia. Let me pull up the exact definition here. Pharmakia in Latin comes from healing with harmful medicine, healing from poisonous herbs, a drug, poisonous potion, or magic. That is the root of pharma. Pharmakia, pharmacy, pharmaceuticals. So right there, it is everything you need to know.
Some magic pills.
It's poison. That's what it is.
Yeah.
And before we dive deep into this, I'm not saying like abandon all medicine. Like lidocaine's awesome.
I'm saying it.
I couldn't imagine having dental work done without Novocaine.
Flush all your prescriptions. Take no drugs. Raw dog life.
Aren't you not supposed to flush prescriptions? Isn't that a thing?
I'm telling you to.
Okay.
Well,
Well.
never mind.
This is not a PSA.
No.
But yeah, the fact that the name alone is derived from something that's not good for you is crazy.
Yeah, it seems a little on the nose.
Yeah,
too.
and no one looks into it.
Yeah, right. I don't know. I think that's a little scary. I'm a little concerned about pharma, how big it is.
And again, we're going to be doing a bunch of bouncing around here, I'm sure, but I think one of the major points to bring up is the fact that I think it's 97% of all pharmaceuticals in the United States are owned by two parent companies.
Yeah, that's terrifying.
Like, it's easy for me to sit here and tell you that, Frito-Lay is owned by PepsiCo, and you can
Right.
understand that, my Doritos come from the same people that make Pepsi.
Right.
That's an easy concept to comprehend. If I tell you that, hey, this Advil that's on the counter, or these Band-Aids even, or this
Mhm.
laxative, these all come from Pfizer or Johnson & Johnson. You'd be like, okay, you're a conspiracy theorist now. And look, the way that there are two major corporations that control all of the pharmaceutical industry in America
Mm-hmm.
is because they just buy out smaller industries. That's all it is. They buy out smaller pharmacies because they have the power to do so.
Well, and that's like, I feel like you look in any industry. You look at any
Yeah.
industry in the world, any market, and you'll come to see that it's 3, 4, 2 big companies
Right.
that, just as you said, they have the money to, so they buy out these smaller companies, and so is life. You know,
Yeah,
like
yeah.
that's just kind of the way it is, and that's terrifying. That's concerning.
Right. And like exactly like you said, though, there's no separation for the medical industry. It's the same as anything, and there's no regulation. We're one of the few, if not only, nations that don't have any regulation in terms of market on the medical industry. So people can do this.
Yeah,
You don't
right.
have to have any stock in the medical industry. If you have the money, you can just start buying pharmacies
So
and pharmaceutical companies.
it's like a money making thing.
Oh, absolutely. That's all it is.
It's become a money making thing.
I want to talk. What's our man's name? Martin
the-
Martin Scully.
Martin Shkreli, the
Martin
big guy,
Shkreli? Yeah.
the big guy.
Because I think this is the greatest example of it, and maybe the most well known,
Yeah,
other than one other I have in mind. But Martin Shkreli
Shkreli.
was the CEO of Turning Pharmaceutical, the company that he just bought.
Mm-hmm.
He was an investor. He bought Turning Pharmaceutical, the company, and then he bought the rights, the copyright, the patent for Drapamine,
Mm-hmm.
Daraprim.
Yeah.
It's one of the Daraprim, I think is how you say it.
Mm-hmm.
He bought the rights to the prescription drug Daraprim,
Mm-hmm.
which is used in. It helps with HIV. It helps fight HIV, but it also helps. It's the main thing that we use to fight malaria.
Right.
And he bought the rights to this drug. Just only one in America that can not use it, but mass produce it essentially.
Right,
It's-
Manufacture.
Yeah, manufacture it. And he changed it when he bought it. It was selling on market for $13.50.
Mm-hmm.
He changed that to $750. Now, I'm not talking like over the course of 10 years. No, when he bought it, he changed the price to purchase this drug for any pharmaceutical company, any manufacturer, any hospital from $13.50 to $750.
Right.
That's
Per pill.
Per pill, yeah. That's an
Insane.
insane index.
Insane.
And he was asked why he did it, and he was asked, what the reason for it is. There shortage? No, he literally said it's to make money, and it's an essential medicine that we need. It helps fight the malaria.
It's a vaccine for malaria.
Yeah, yeah.
It's
the reason we don't have malaria.
Yeah, right. Crazy.
And he on
Evil.
record has said that he would have charged more for it,
Yeah.
looking back,
Evil.
because there's more money to be made. It's an insane concept that this dude just bought the rights to an entire prescription, to an entire medication. And you can do that, and it happens all the time.
Yeah, that was something that you kind of brought up before, is like he wasn't the first. He's just someone who kind of
Mm-hmm. Right.
brought this idea to the more broader public. And like, I think it's even interesting that, we talk about down with big whatever,
Yeah.
up with big as
Milk.
up with big milk, whatever.
Down with big milk.
Down with big milk. Right. Oh, excuse me. But
Don't
like,
get your political agenda twisted here, pal.
But like, it started with big pharma.
Yeah.
Big pharma, big pharmaceuticals, and like the whole Martin Shkreli thing is
Yeah.
like, that's where big pharma, or that's where down with big pharma, that's
The
where
meme, yeah, that's where
Right.
it came from.
it's just interesting to me how deeply rooted and like yeah, I don't know, like you can see the pattern happen, and it's like, well, what do we as people do?
Right.
If you have malaria, what the fuck do you?
Guess you're paying.
Yeah, right.
Guess
What-
you're paying.
you cough it up, right?
Fun fact, that guy, Shkreli,
Yeah.
was released from prison in Pennsylvania in May of 2022.
He went to, not for anything drug related. He went
Mm-mm.
to prison for like
Conspiracy
wire fraud conspiracy or
and
something like that.
securities fraud.
Securities fraud. That's what it was. Yeah, it wasn't anything related to the drug industry. It was
Yeah.
him just trying to get more money illegally.
And because that's legal in the drug industry.
Yeah.
That's that's the way it goes, and so they're not gonna slap him on the wrist for it, or they're gonna slap him on the wrist for it.
Right.
sort
That's
of
how
thing.
they
Turn
got the
turn a
mob
blind
guy.
eye.
The mob guy?
They got him for tax evasion or something.
Talking about Al Capone?
Yeah.
Yeah, they got him for tax evasion.
Instead of all of his
Yeah,
other
yeah.
crimes.
Yeah, they didn't get him for anything mob related. It was because he didn't pay his taxes.
It's like
Um,
OJ. You know, killed his wife.
Glove didn't fit, buddy. Sorry to tell you.
They
Must
got
have
him.
quit.
What they get him on? Selling memorabilia or something like that?
I think part of it was also taxes.
Or was it
Like,
a
I
tax
think there were
thing?
2
Or was
charges.
it a tax evasion thing?
I think.
I don't remember.
I-
But they got him on
yeah.
something completely different, other than
Not
the
for
fact,
murdering his wife.
Yeah, other than the
Yeah.
fact that he murdered his wife.
Yeah.
Crazy.
But to your point, like you said, it doesn't have to be a company. It could just be a guy with some money who's
Which
an
is
investment banker like this dude, or an
Yeah.
investment broker who just purchased a pharmaceutical company because he knew about this product.
Right. Like he was just a guy.
Yeah.
He wasn't. He didn't go to college.
Yeah,
for
didn't have any
this.
kind of medical background.
Right. Just
Yeah.
the guy who is into money.
Which essentially is how we get to 2 major companies controlling all of our pharmaceuticals, Pfizer and Johnson & Johnson, because they don't buy products, they buy companies. Oh, this pharmacy in Upper New Hampshire has a cure for this thing they're working on. Before they finish it and put it to public market, let's buy the company now that's ours, and we determine when it gets released, if it gets released, and how much it gets released for.
So crazy.
It's ridiculous.
Yeah.
There's a case recently that I had written down here. It's a company called Gilead, and they bought the rights to a pill that cured the Hep C.
Mm-hmm.
It cured it in 3 months.
Hepatitis.
Yes, hepatitis C. Cured it in 3 months. The only pill on the market that's ever been able to cure hepatitis. And it's 3 month supply. You take these daily pills, and by the 3rd month, it's completely gone by when you're done with your pills. One and only drug like it.
Right.
And a small company or a small pharmaceutical company was developing it. Gilead bought the rights to this company, completely took it over, and are now selling the cure for hepatitis C for $84,000
Oh,
for this 3 month supply of
Gosh.
pills.
Oh my gosh.
Yeah.
And what
It's a little over $1,000 a pill.
was it initially?
It wasn't released yet.
So that was just their opening.
Yeah, and they set the price for it
Crazy.
to the point where when they released it in Europe, I believe there was a massive outrage because apparently they have a higher hepatitis epidemic in Europe.
Interesting.
But there's a whole outrage in Europe and France about it, and like they protested the sale of it. They protested pharmacies and everything, and they ended up cutting it by half to where it's I think it's somewhere around like 20-something thousand euros now, 24,000 euros is the conversion. But like still, it's still ridiculously priced.
Yeah.
And they consider that the people of the UK consider that a win because now they're not paying $80,000, they're paying $40,000 for it, right?
Right.
Still not.
Still ridiculous.
Yeah, still more than you should be
ridiculous.
paying
Right.
for 3 months of pills.
Yeah, and they just they get away with it.
Yeah,
Because
Because there is, especially in America, there's no regulation.
well, and why isn't there government?
Well, and I'll tell you this, and I think I brought it up last week. Capitalism works. Capitalism is a
Yeah.
beautiful fucking system. The problem with capitalism in America is we don't regulate monopolies like we should. We have very much loosened what defines a monopoly. Because it's just like everything else. It's like the radio business. It's like chain restaurants. Because there is not one company that makes all of the products and all the money and owns all the things.
Mhm.
Because there's 2 major corporations, it can't be a monopoly.
Mhm.
Because there's competition. It's still a fair market if there's 2 companies. So even though that all of the pharmaceuticals are owned by 2 companies in America, well, it's not a monopoly because you have a choice.
Yeah, right.
It's either company A that's charging tens of thousands of dollars or company B that's charging tens of thousands of dollars. So the problem isn't, the fact that we have a capitalist society with an open market. The problem is the fact that we don't regulate monopolies. We've become an oligarchy where we are very much a nation. And I mean, if you want to look at a broader term, a world that's controlled by companies.
Right.
Because you have billionaires who have no stake in pharmaceuticals sitting on the board of the FTC and the WHO. Bill Gates is the #1 contributor to the WHO, the World Health Organization. #1 funder. So whatever stance he wants to take on any medication or any pill or anything like that, any drug, whatever stance he wants to take, the WHO are going to follow suit because if not, they're going to lose the majority of their funding.
Right.
And that's a ridiculous amount of power that no one should have.
And
fact-
he's not even in health.
No, some guy that marketed computers
Right.
is controlling what gets regulated as a federal drug in our country.
Well, and then it becomes a conversation of like, do you regulate that? No. We're going to break.
We'll talk
Fuck
about it when we
it.
come back. 216-859-8699. What drugs are you on?
Hi, this is Melissa,
And hey, it's Matt.
coming at you from Synergy Music Studio.
We are a recording and production studio located on the south side near Chicago.
Check us out online at synergymusicstudio.com. We offer recording, mixing, and mastering.
And follow us on Instagram at Synergy Music Studio. Rock hard.
Imagine spending hundreds of dollars of your own money to advertise a massive corporation. Now imagine that same corporation using your money to pay a public figure to sell a product back to you. Unfortunately, you don't have to imagine. Corporate product placement is the monopoly of the clothing industry as we know it. That's where GenericClothes.com comes in. Stick it to these big brand clothing cunts by wearing something straight and to the point. GenericClothes.com's got you covered and lets you have a laugh at their expense. Nobody cares about the details. Get to the point. With shirts like floral pattern, trademark logo, music band, and more. Once again, that's GenericClothes.com.
Off Air, hosted by Shane E. It's a show. It's on 3 p.m. weekdays, WSR Radio.
Tune in.
That's
It's electric
that's
stuff.
the read. That's how it's written. Thank you, Shane, for that electric read.
Welcome back to the Rebel Podcast. Honestly, look how rebellious they are. We're going to do incredible things here. We really are. Honestly, listen.
Before we went to break, we started talking about how the fact that Big Pharma is just a collection of two, essentially, pharmaceutical companies that rule everything because they've bought everything. You know what's similar to that? The big brand clothing companies.
Ooh.
So, unlike the big pharma industry, where we really don't have much we can do in terms of fighting the big pharma. Yeah?
Yeah.
Nice little squeak in there.
Yeah, you know.
Well, we don't have much we can do in terms of fighting big pharma than holistic medicine. We do have a way of fighting big brand clothing companies, and that is GenericClothes.com. You go to GenericClothes.com, and you can get all of your sweet merch like band shirt, local artist, famous musician, politician, political statement, local event, county fair, all on a shirt, all at a fair price without supporting big brand clothing cunts. Go to GenericClothes.com. Jules, you had something you wanted to contribute.
Basically, there was a pharmaceutical lawsuit that happened.
Mm-hmm.
It was GlaxoSmithKline. That's
Is that like the...
That's the company LLC.
Okay.
They pled guilty to promoting prescription drugs and failed to report safety info on their promotion.
Okay.
This drug was basically made to treat diseases from HIV, respiratory diseases, and conditions. And the people that took it ended up getting lupus and cancer.
That's bad.
They paid out $3 billion for that lawsuit.
There's a lot of cases of that, of just drug companies not reporting or not disclosing or not even knowing the side effects before pumping the drug out because it will make them money. And, I don't want this to become a political thing, but that's a lot of the issue we had with the COVID vaccine is it was untested. It was an unregulated drug that the FTC pumped out because you had big backers like Bill Gates going, oh, nope, here it is. Let's make money off it. And that's a crazy concept to me. The fact of not basing medicine off medicine, but rather how much money you can make is corruption. That's all it is.
Yeah, and I feel like to even dive into a nitty gritty of you have to think about there are what do you call them? Representatives for these prescription companies that will go to different hospitals and
just like pitch the drug.
pitch the drug no matter what, and sell it relentlessly. And that's
like you said, it's just like anything else. If I'm a promoter for a band, I'm going to go to every venue and pitch this band, whether it fits your demographic or not. I'm going to pitch it to you.
They're
exactly
door-to-door salesman.
right, but it just on a
But
much bigger
larger
and
scale.
more serious scale.
Yeah. There's a couple of quick things I want to bring up here just as passing comments. I think the overall message of Big Pharma in today's show is the reason that we have this conversation is because we don't cure diseases, we treat them. And the reason we treat diseases instead of cure them is because it's a lot more cost efficient to have a recurring customer. If we're treating something and you have to keep coming back and paying for medical expenses, they're going to make a lot more money than if they sell you the cure for something. And I think that's why a lot of these diseases, quote unquote, don't have cures. I'm sure there's a lot out there that, like an HIV, where we don't have the capability to cure that at this point.
Right.
But I think there's probably some things on the market we do have cures for. Some things that are very life-threatening that we're making, not we, but the pharmaceutical industry is making hundreds of thousands of dollars on monthly,
Right.
if not daily.
Well, what did you say? It's like 40% of
40% of the population believes that there is a cure for cancer.
And that's when I don't doubt.
Told.
That's when I don't doubt.
right.
And I'm not saying all cancers, but there's probably some.
Probably specific ones.
Yeah.
Sure.
And I want to bring this up too, is because I think most of America's problems today is with the food we eat, which is also regulated by the FDA, the Food and Drug Administration, by the way. Same company that's pumping you full of pharmaceuticals is the same company telling you what can go into food.
Super interesting.
Yeah.
Like
it's the same people that are telling you there's an allowed amount of lead in your Lunchables.
The food and drug.
Yeah. Yeah.
Like, come on. Those are the two things that we are ingesting as people.
Right. You got to have the drugs because you're not getting the nutrients you need from the food that's coming from the same people.
Womp womp.
Crazy.
1.9 million people get cancer every year.
I want to know what the increase in that is over time. That's the number I'd be more curious about. Like from 1960 to 2024, how much has that number increased per year? How many people?
I'm curious how
In-
much.
On average.
In just 2022, 6,366 people died of cancer.
Okay, but so here's what I was getting at with that. Most of the illnesses that we have today, if you do the research, it's from deficiencies. It's some kind of mineral deficiency, some kind of vitamin deficiency, some deficiency that we are not getting, oil deficiency, whatever it may be.
Right.
That is where most of our illnesses come from today, and that's general illnesses, that's dietary, whether it's like IBS or things like that. It's skin, hair, things like general illnesses. Most of it comes from deficiencies. And the reason that we have that is because there's 90 essential nutrients that make up the human body that it needs to function at peak efficiency. We are not getting half of that in our day-to-day food. You can go and buy organic lettuce at Whole Foods, and you won't get what's supposed to be in that because the FDA is regulating how much legally of these essential nutrients need to be in that food. And it's nowhere near what we need to live. And the reason for that is because then they can sell you supplements and protein powders and drugs and pills to cure your illnesses now. And it's a whole fucking cycle that it's the snake eating its own tail. They're selling us foods that don't have the nutrients so they can turn around and tell us we have diseases and sell us drugs that cure those diseases.
Right.
Meanwhile, we're shilling out all the money for it. When it comes to the topic of cancer, there's research that I've only heard about one time, and I went and for this episode made sure it wasn't just a bogus claim I heard somewhere, that there was actual research done about it, because no one talks about it. Because the FDA has a stranglehold on everything and it's considered holistic medicine. Sunflower seeds.
Oh, yeah.
Sunflower is really good for curing, or not curing, but preventing the growth of tumors in certain kind of cancers. It essentially nullifies the word I'm looking for. Essentially nullifies the growth of the cancer cells in tumors. So I believe, and I could be wrong, I believe leukemia was one of the main ones they talk about. So it's advocated to eat sunflower seeds or things that are high in sunflower because that works actively against the growth of cancer cells in your system. When have you ever heard that told to a cancer patient or in any conversation discussing cancer? Because I haven't. Until I did the research for it.
Well, and I think that's something too that's interesting is like it's probably very easy for these companies to like disregard something as holistic medicine and then create the idea that holistic medicine is like
Pseudoscience, essentially.
pseudoscience or lesser than, or like
Well, and to your
there's
point,
the real stuff and then there's this silly witchcraft,
Right.
like
and to your point from earlier that these pharmaceutical companies will go to hospitals and pitch this
Yeah,
product to them.
right.
That's why they can't do it. The hospital is signing deals with Johnson & Johnson or Pfizer
Right,
or a smaller pharmaceutical company that's saying, hey, we are going to prescribe this drug for these
Yes,
ailments.
right.
So we legally cannot tell you, hey, this is what we would prescribe, but there's a holistic approach that might be. They can't do that legally.
Right,
And there's certain
right.
states that I looked up that they can't even like recommend holistic medicine. Like you can go to a pharmacy and maybe you're not getting a diagnosis, but you're saying, hey, I feel this way. I read about this. What do you think about
right.
this
you
holistic
can
approach?
initiate that conversation
Right.
and see where it goes.
They're
sort
not
of
going to
thing.
out of the gate recommend it to you,
Right,
obviously.
right.
But you can typically, have that conversation, especially with like a practitioner.
You can egg it along. sort
Yeah,
of
sure.
thing.
Your family doctor.
Right.
But there's a lot of states where it's illegal to even recommend holistic medicine, not because a contract with the hospital itself, but the state has decided that you cannot prescribe holistic medicines.
Right.
It's insane to me.
It's super. And then that's another thing too, where you like the drug industry and the medical industries are like intertwined, shaking hands.
And the
both
insurance
making
companies.
Oh yeah.
yeah, and the insurance companies. Yeah, they're all intertwined, shaking hands, making money as we keep coming back, and this is very serious, and we need something done. And they're recommending this, or they're prescribing this thing that some salesman
Yeah.
came a year ago and said, we're gonna, you guys are gonna sell this stuff at this rate for these illnesses. And yeah, it's kind of like, and it's something too where working in the medical industry and seeing that it is really just a business.
Yeah.
How the employees view it as a business, and hearing, and I mean, again, this is all secondhand here,
Sure.
but like,
Yeah, let me point out, none of us are practicing in the medical field or have any kind of
right.
license to give you any kind of recommendations.
Right. We don't have any skin in the game.
Yeah.
But yeah, it really, you see the seedy underbelly of it all.
Mhm.
And like big pharma is just another one of those things where it's like, yeah, clearly this is all some kind of circus
Yeah.
that they're trying to propagate.
It's a business.
Right.
At the end of the day, it's a business. And, I hate to give him credit, but Martin Shkreli goes on record and says, hey, if I could turn back the clock, I'd up the price more for this drug and charge people more for it because it's a necessary drug and you're going to pay because you need it. And at the end of the day, no one wants to say it, but that's how it works. It's about making money.
Well, that's what they did with EpiPens.
Yeah.
Yeah.
Well, there's a two company. The same thing in the UK happens. There's two major pharmaceutical companies, and I'll talk about them, I guess, when we come back. 216-859-8699. I said disclose your drug information. Don't do that. That's a HIPAA violation.
I'm not really sure on which order Style prefers to put these ads in, but I'm the Pidge, and that's okay though, because time isn't real. Oh wait, this is the wrong show. I'm talking about the Pigeonhole, everybody. Comes out once a month. Send some stuff into the Styles Rebel Radio Discord page. I will give my such beautiful 2 cents on it. I know you guys care so much. Whatever. Hey man, I'm a free content creator. Give me some slack. I like doing this.
Hey, Style here, and I want to take a minute to talk to you about Hellbender Vinyl, a proud supporter of local and independent music and a proud supporter of WSRR Radio. Hellbender Vinyl is one of America's most trusted custom vinyl pressing plants. Located in Upper Lawrenceville on Butler Street, Hellbender is Pittsburgh's first and only vinyl record pressing plant and is here to help local bands and artists get their albums onto vinyl. Hellbender Vinyl offers vinyl record pressings to ensure that albums don't just end up as a bunch of ones and zeros floating around somewhere on the internet. So, if you're interested in giving your album a physical release, you can visit hellbendervinyl.com to start the conversation today. Plus, every customer at Hellbender Vinyl receives 5 free test presses to review at no additional cost. Hellbent on quality, hellbent on service, hellbendervinyl.com.
I'm Jeff Stritch. Catch Strictly Stritch weekdays at 8 a.m. on WSRR Radio or Listen to the podcast on Pandora, Spotify, or Apple Music. Very important that he put Pandora first on the list.
(216-859-8699).
Call now.
We're back on the Rebel Radio Show talking about Big Pharma during conspiracy season. But first, we got to talk about Synergy Music Studio. They're out of Chicago. They work with local and independent artists in the area to get your tracks album ready. You can go into Synergy Music Studio, lay down your track in their state-of-the-art studio, or even sign up for a naked session where they can do live video performance as well. They get you all of the cut content for that and send it back to you. And if you're not in the Chicago area, take advantage of Synergy's reamping service, where you can send in your unfinished track to get reamped through all of their. You can pick out what kind of sound you want. You want a fuzzy sound to it? You want a crisp sound to it? You want a 1980s Stratocaster sound to it? You send it right over to Synergy Music Studio. They'll run it through their reamping session and get it back to you album ready or radio ready. Again, that's synergymusicstudio.com. They're based out of Chicago. We're talking about Big Pharma, and I want to bring this up real quick before we went to break.
Bring it up.
I brought out some prescription, some non-prescription medication that I had in the cabinet.
Yeah, I came into the studio today, and Style was organizing his prescriptions in his usual.
There's only one
recording
prescription
spot.
there.
Well, I'll tell you, there's a lot of pills.
There are. Well, it's a
little concerning.
It's acetaminophen, it's Neosporin, it's allergy medicine, and it is a prescription eye medication that I had.
Are we popping pillies?
Yes.
Are we getting freaky?
We're supporting Big Pharma now. We're just going to take all the pills.
Okay.
And then we're going to get sick, and we're going to have to go to the hospital and get more pills for it.
A little bit of that Monster Mash? Just
No, you have a Monster there.
Oh,
we're not sponsored by Monster, but we'd like to be.
Yeah.
They're not bad.
Yeah.
But I specifically pulled these out because I just have generic, drugstore brand acetaminophen there, and I had Neosporin. Pretty common things, right?
Yeah, sure.
And I encourage anyone at home to after hearing this conversation about the fact that the pharmaceutical industry is just a monopoly, look at any of your prescription medication. They'll tell you who they're made by. And even if it's a pharmacy you might not recognize, or it's a local pharmacy, Google who that pharmacy is owned by. Because my acetaminophen, that's just drugstore brand, Neosporin, those are both produced by Johnson & Johnson. So me just buying fucking something for a headache or a small cut on my hand is going to Big Pharma. That's like, this isn't, a cure for cancer or HIV or Hep C. Like, this isn't serious medication. It's your typical drugstore medication that's also owned by Big Pharma. So that's I think that was ridiculous. And I encourage everyone to, when they buy medication, if they have to, maybe do a little research into who the parent companies are as well.
Interesting. And it's one of those things, too, where, like, say you're in the grocery store and you look it up and you see that it's owned by Johnson & Johnson. What do you do?
Yeah.
What do you do? Like, you're like, well, okay, I guess I'm fucked.
Yeah.
And every other one up there is going to be owned by either that one or Pfizer or whatever,
yeah. Which, again, I don't want to sound like a hypocrite because obviously I have this stuff in the house.
Yeah,
I use acetaminophen when I have a headache.
Yeah, right.
And they're all, like I said at the beginning of this, I'm not saying all drugs are bad, but there are probably holistic answers to a lot of the issues that we have in day-to-day life.
Yeah, I think that is a good discussion of why do we look at holistic medicine the way that we do as a society, as a culture?
Because that's how it's been painted to us.
And I think even you using the term holistic, like you have this mental image of like a hippy-dippy,
crystals and dream catchers.
Just from saying it. And it's just because that's how we've built it up as a society. I'm sorry to have my Joker moment again, but
we are a society.
Yeah, but like it's interesting.
Holistic practitioners are called naturopaths.
When have you ever heard someone like, "Oh yeah, I'm going to my naturopath"?
Right.
Like what?
And you can. And literally all that means is they're using roots and vitamins and things that you can just buy at the store rather than buying drugs that you don't know what's in. Because even something as small as acetaminophen, where it's like, oh, I have a headache, I'm going to take 2 aspirin. Look at the back of that and see how many things you can pronounce on it.
Right. This is, so, sidestep a little bit, but I've always had that same idea, and I wish there was a similar approach with, shampoos and body washes and conditioners. It's all just a tub of white or blue or green, whatever, liquid, cream liquid and you just lather it on yourself.
Just trust the process.
They have oatmeal stuff that I like to use.
And I would totally try something like that, because you got to think, and this might sound holistic, but like there were probably people 300, 400 years ago who would like find specific leaves and herbs and berries and mush it together, rub it on themselves, and that was their soap or whatever the case may be. I don't know.
So let's take that then, because you look 300, 400, 500 years ago, right? And people were getting by just fine. There weren't as, and we weren't as advanced. People were probably dying of a lot simpler things that we have answers now to, like polio, like malaria.
Right.
And again, that's all well and good, but people weren't having as many health issues day-to-day life as we are today. And it's insane. And it's because we're lacking nutrients in our food, because it's not actually grown the way it's supposed to be. Even non-GMO shit is still modified. It's still up to a certain standard the FDA has deemed appropriate, which again is just made up of a bunch of people that have money that are funding this, don't necessarily have to have medical background.
Eating its tail. They're the ones controlling the snake that's eating
lead
its tail.
in Lunchables.
There is an allowed amount of lead in everything you can eat, and not just lead. It's
There's
a bunch of shit
in your tampons.
Yeah.
There's
yeah. It's really, really interesting. And then like having to sidestep to a quote unquote more holistic approach like feels avant-garde. Like it feels
it shouldn't.
You feel like an outcast or something like that. And yeah, you're right. You shouldn't feel like an outcast. You're trying a different approach that could potentially be a million times better. And it's like a situation of everyone is different. Everyone is so different. So what may work for me might not work for you, and you might have to try this, and that's why there are multiple, and maybe you do need to take the prescription pill, and like that's another thing too, is like I don't necessarily have a problem with the acetaminophen or the whatever that it works. It takes your headache away, it kills the pain, whatever. The prescription does what the prescription is supposed to do 90% of the time, and I've never had negative reactions.
Right.
Could be, like very blessed to say that, and who knows, maybe in whatever, but like this this is just a problem. I don't know.
We very much live in a drug culture of something is wrong with you, here's the solution.
Right.
And I think that's crazy. And don't get me wrong, there is a mental health crisis going on, and I don't think the answer to that is, okay, well, you're depressed, have this pill.
Take this pill.
And I'm not
Try
saying
this
that
pill.
I'm not saying there aren't situations that call for that, but I'm saying that shouldn't be your first response.
Yeah, right.
Oh, you're feeling a little sad today? Here's Zoloft.
Right.
That's not how this should work. And it's sick that it does that, even because you even have psychiatric professionals, therapists that can write you a prescription to go get Zoloft or lithium or any of these other antidepressants after one visit and one conversation of, oh, well, you felt sad because your grandmother died. Here's a prescription. It is normal to go through anxiety, sadness, depression. And I looked into this because I wanted to know how much of it is related to the FDA and just drug culture we live in, and how much of it has been actual advancements in medication.
Yeah.
And I looked into it, and there's many, many, many records of professional psychologists and psychiatric professionals going and saying that this has done more harm to our culture in terms of mental health than anything, because while there are examples where, medication is probably needed if you have, schizophrenia or some severe depression or things like that, we shouldn't be pushing these pills because it is normal and expected, and has been, like you said, for hundreds and hundreds of years for people to experience sadness and depression and anxiety in scenarios where it's warranted. That's how the brain works. And how the brain works is, let's take, you lost someone, for example, right? And my grandmother died. You're supposed to feel down. You're supposed to feel sad and depressed and detached. And it's the stages of grief that you go through that teaches your brain how to deal with that.
Right.
Now, if you start that process with, something bad happened and now I'm sad about it, and your doctor goes, here's lithium, your brain doesn't go through the process it's supposed to.
Right.
And it does more harm long-term to how your brain functions.
I feel like my brain has problems functioning, so sorry guys.
But
it's all the lithium that I've been listening to lately.
They'll do that to you. But no, we shouldn't. And again, I'm not saying that medication is unwarranted for mental health issues. I'm saying it shouldn't be our first line of defense.
I'm sorry. I think that's kind of where I was trying to go, is like, I think if holistic approach is cool, and if that works for you, awesome, that works for you. It might work for me, it might, whatever. I if you need to take if the prescriptions work for you, use them. And I don't necessarily have I don't have a problem with that. It's the fact that it's a monopolized system
Yeah.
of 2-3 companies running the show, and we don't see doctors being like, oh, why don't you try this? This is a little bit more obtuse approach. This might be a little bit different, but why don't you try that? You know, it's always a pill pumping process.
Oh yeah.
I think that is where because it's like a system. It's like you said, it's a snake eating its own tail. You go to the hospital, you get the medicine works for a little bit, and then it goes away, or something different crops up because of, and then you're on a new, and it's just forever.
Yeah.
And so that's the problem that I have is we don't it's like you're doing a holistic approach is like voting for like the Green Party or something like that. You're a weirdo, you know, and it just shouldn't be that way.
Yeah, no, it's ridiculous, and I think it all does always come back to what you said of it's someone selling something.
Yeah.
It's, they're not prescribing you Zoloft because you're sad. They're prescribing you Zoloft because either the company has a deal with them and they're told that, hey, this is the answer to these side effects. That's what you got to do. Or it's something along the lines of, oh, well, as a society, this is the drug that is deemed for this thing, and this is what I've been taught to give for this thing.
And I remember like learning that it was a sales pitch for drugs, for pharmaceuticals, that like there's someone going in, there's a board meeting, and someone comes in, and essentially it's a sales pitch in front of the execs of, this is what our drug is, this is what it does, these are what it treats. These are what we say it treats.
Yes.
And so this is what you have to, if it seems like X, Y, or Z, and you would normally give this, now you're going to give this. And this is the price that we're offering. We have shown in this test demo that it works in 90% of our subject or whatever.
Well, and that's an interesting point too, of these companies will market pills for, okay, this is depression medication, right?
Mm-hmm.
But it could also be used for bipolar disorder, and it could also be used for your equilibrium being off.
Or you can use it to lose weight.
Yeah, and it all depends on what that company says. The point I was going into before we went to the break was there's 2 companies in the UK, and one company had developed it was a syringe, it was a vaccine, to help aid with a certain kind of cancer. It wasn't a cure, it was just, to help aid with the process of it. And a pharmacy had found out that while it wasn't super effective in actually, helping the cancer patient, it didn't make the cancer any better. While it wasn't super effective in that, it did, as a side effect, cure AMD, adult macular degeneration, which is a disease that causes your eyesight to get really bad and essentially lose vision as you age. And they found that as a side effect, it was really helping people with macular degeneration. So this pharmacy started making, people, they could prescribe it as a syringe or as a drop that people with macular degeneration could take and be prescribed. So when the parent company who made this drug found out about this, they went, well, why is our drug being used for macular degeneration? It's a cancer drug. Why are you prescribing it as this?
Right.
At the same time, there's another company who saw what was going on and made a drug specifically for macular degeneration. And they went, oh, okay, so that we see what that can do. It's not marketed as a macular degeneration drug. We're going to market ours for that. So they did, and it was twice as expensive because it was for macular degeneration.
Right.
Now, the fun part is the initial company went, oh, well, that's on the market now. We are going to sue you if you use our drug for macular degeneration, because their claim was, we make drugs. We make medicine we make drugs for issues that don't have a medication already.
You're saying, just to clarify for myself and for the listeners, you're saying the drug company was turning around saying they would sue the hospitals?
Yes, they would sue the hospitals and pharmacies if they prescribed this drug that they had been using that was for cancer for macular degeneration, because their claim was, well, now there is a drug for that, so you can't use ours. We don't make drugs for solutions we already have, essentially.
Right. Wow.
So they're forced to pay the more expensive one because company A, where they found out this information through, said, no, that's a cancer drug. That's not for that.
We'll sue you if you do that again.
Yeah.
That's so crazy that they turned
just
around.
because they decide what it's for.
Yeah. And
regardless of what it can do.
That's like a pharmaceutical. That is legitimately a pharmaceutical company dictating how a doctor treats its patient.
Yeah.
Like 1-to-1.
Yep. It's no longer about I'm seeing a doctor because I want his medical opinion on what's wrong and how I can fix it. It's I'm seeing a doctor and he's going to look at my symptoms and look at the list of things that go to these symptoms and what to give me now.
Right.
It's not, oh, in my opinion, it's probably this and this could help. It's, oh, the sheet says you have these symptoms. The sheet says this is what I can give you. That's what it is now.
Terrifying.
Yeah, it is. And on the flip side of that, like we started talking about, is now you have people that are, have bipolar disorder and they're being given Zoloft, which is a depression medication.
Right.
And, it might help with their bipolar disorder, but now they have severe suicidal thoughts or severe side effects of this prescription because it's not for that really.
Right.
But your pharmaceutical company says, oh yeah, no, it's a cure-all. It'll do that too.
Right.
That's crazy to me.
Like at what point does the government get involved? Or
and that's the thing is the people that regulate it are the FDC. They're getting paid for it. Or FDA, sorry.
Yeah, and so what? Those are, the FDA is voted in? I have no idea. Who are the people who are working on the FDA? Who are those people?
It's those fancy 3 letters.
Yeah.
You can't trust them.
Don't trust 3-letter organizations.
Who is Mr. FDA?
The fact that it's a board of just rich people who want money in the pharmaceutical game.
Yeah, and it's
that fund it.
And so then what? It's a situation of I sit here now and I say, what can we do as people?
Right.
What can we do? If I have a headache, if my tummy hurts, the fuck am I gonna do?
I think my story here, what I would take away from this is, to your point of what can I do, it's I'm going to look into the holistic approach, look into the natural approach to cure these things rather than going, what's the cure-all for it?
Right.
Because, like we said, look at the ingredients that you can't pronounce, look at the list of side effects that are probably worse than the thing you're trying to get rid of, and see if there is some kind of I have a stomach ache, instead of taking 3 Tums or Pepto-Bismol, maybe I'll drink ginger.
Right.
The head of the FDA is basically nominated by each president.
Oh, really?
Oh, interesting.
Yes.
That's scary.
That's interesting.
That's a scary thought.
Right now it is Robert M. Califf.
And they don't talk about that.
He was nominated by Biden.
When have you heard about that?
I didn't know that was a thing until literally right now.
We're literally coming up to the election.
And the president is the one that nominates the leader of the FDA.
The guy of the Food and Drug Administration.
That's crazy. That's crazy.
The more you learn about your own
that
country.
means the FDA is a lot more powerful than we think.
Yeah, right.
Oh yeah, no, they're immensely fucking powerful.
Okay, well, what do? We gotta eat food. We gotta take drugs.
Yeah.
What do we do?
Yeah. What can you do? That's the thing, right?
All right. Well,
and I want to say this too. I want to bring this up. I know we got a couple minutes. In terms of the side effects and things that are being prescribed, you hear stories all the time of fentanyl used to be an over-the-counter drug you could buy, and they used to prescribe all these different cocaine you could get over the counter, right? They used to use meth for shit and amphetamine. By the way, they still use amphetamine. That's all Adderall. Adderall is a dumbed down amphetamine. But think about we have all these horror stories of things that used to be prescribed, and now they're hard drugs that kill people.
Right.
All these things that used to be. Why the fuck would we think we're any different now?
Yeah, right.
We're pumping out 3 times as many drugs that we don't know what they do.
It's worse.
You don't think in 50 years they'll be like, oh, they used to sell Ozempic over the counter.
Imagine
and now
that.
people are ODing on it.
Imagine that, yeah. People are getting high, it's like putting the Ozempic on the spoon, lighting it.
Right. It's insane to me. The fucking oxycodone is one of the most addictive drugs in the world. And you can still get it. It's not as common as it was, but you can still fucking get it.
Dude, sipping that syrup. Yeah, buddy.
It's insane to me. And to think, if anyone's out there thinking, oh, well, at least we're not 50 years ago when they were prescribing cocaine. No, we're still there.
Yeah.
It's a different name, and it's a more complex drug.
Right.
And in 50 more years, they'll say, oh, I can't believe they were prescribing that.
Yeah. Yeah, it's really... and that's another interesting thing, too, how, So Ozempic is another, just really quick, Ozempic is a a drug that recently became super popular, and it's like a household name.
Yeah,
now.
it's marketed for weight loss.
Marketed for weight loss. But it became a household name so quickly, and something that now we all, just on the drop of a hat, we know what that word means in relation to now. And it's because the FDA is pumping this drug.
Yeah,
for
they
this
can make
thing.
money off it.
They know that it works. They know that fat people want to get skinny.
Yep.
And so...
I mean, it was originally a treatment for type 2 diabetes.
Yeah.
Right.
Yeah.
So
Right.
They're like, oh, we noticed it has a weight loss element to it. Let's sell it as a weight loss drug.
Right.
Yep.
Crazy. And the FDA makes money off it because they put it out there and they're getting the kickback. Insane to me. 216-859-8699. Echo, thanks for listening in the chat. I bad at neglecting the chat. The number is 216-859-8699. It works for the Rebel Radio Show and all of the programming on WSRR Radio. Remember, this is conspiracy season all October long on WSRR Radio. So not only do you get conspiracy theories every Monday at 5 p.m. Eastern on the Rebel Radio Show, you get conspiracies at the bottom of every hour, courtesy of the Swerve Podcast. They do conspiracies in 3 for us. You can tune in right before the top of each hour, and you get a mini conspiracy theory fill right there. You can also go to WSRRradio.com, of course, our homepage for all of our other shows, showtimes, schedules, and more, like Shaney's Off Air.
That is true.
The Pigeonhole, we have a new show, Behind Enemy Lines, the Pittsburgh-based Cleveland sports show that's coming to WSRR Radio 2, hosted by Lucas DeRazio and Dom Farrow, so make sure you check that out, as well as a whole bunch of other projects and shows on the way. Again, WSRRradio.com is the homepage for all of that information, and the link to the Discord server where you can chat with us personally and the rest of the community more about this theory or any other theories or any other shows or topics that you might want to. Again, WSRRradio.com gets you to the Discord server. Thanks for everyone listening. 5 p.m. on this Monday, 10 a.m. on podcast form, wherever you get podcasts as the Rebel Podcast, or during the YouTube Live simulcast every Monday at 5 p.m. as well.
Thank you, Echo.
Yeah, thanks, Echo, for contributing to the conversation, and make sure you do subscribe and follow us along on WSRR Radio. Don't forget to check out Synergy Music Studios out of Chicago. They do great work in music mixing and mastering, getting your tracks, album, or radio ready. Again, Synergy Music Studio out of Chicago. Even if you're not in the area, take advantage of their reamping service. Thank you to GenericClothes.com for keeping us stylish on the Rebel Radio Show and telling those big brand clothing cunts to suck it, because no one should be paying thousands of dollars or hundreds of dollars even for a white shirt with a red box or a black shirt with a white check mark. No one needs to be spending that kind of money for the same quality clothes. GenericClothes.com has you covered. And of course, thank you to Hellbender Vinyl. I'm going to go on a limb and say, in terms of WSRR Radio, they're probably the #1 user of glitter. That's Hellbender Vinyl out of Pittsburgh, PA. Make sure you check them out if you're looking to make your next album release special, or even if you want to pick up some cool albums that bands in your area and local and independent bands have released. Hellbendervinyl.com. They're one of America's most trusted custom vinyl record pressing plants. And when you use Hellbender Vinyl, you also get 5 free test presses. One more shout out for True Vault Escapades that comes out at 10 p.m. Eastern every weekday on WSRR Radio. It's the Fallout-based radio drama, a full-length 60s-style radio drama completely set in the Fallout universe and timeline. Until next time, I'm going to catch my breath. To my right, Shaney.
Bye, everyone.
On the board is Jules.
Adios.
I'm Radio's Rebel DJ Style. Peace.
Till I think it